Hi, my name's Jeffrey Fernyhough. I'm an orthopedic spine surgery specialist at the Florida Back Institute, which I founded about 26 years ago. We specialize in minimally invasive and non-operative treatments of spinal disorders, and this can include a very popular, common procedure called vertebral kyphoplasty. If you have pain on movement with bending, twisting, and most specifically I found transitioning in and out of bed or a chair, and particularly if this is following a fall or a stumble or a misstep or even lifting heavy objects, even lifting a mat, making your bed and lifting the corner of the mattress, or no particular injury, but you have severe back pain and it's not getting better in a few days, a week or two particularly, then it's a good chance you may have an osteoporotic compression fracture. You should see your doctor, get x-rays, and even if these are negative and pain persists, you should get an MRI. I want to tell you about the actual procedure of vertebral augmentation or kyphoplasty in the painful osteoporotic compression fracture. This involves a patient coming into the office, changing into a gown, lying on their stomach onto the fluoroscopy table where we can take live pictures of the spine, find the exact area of the painful fracture where the crack is located, and place a small needle and then this balloon which is inflated at the end of this catheter through the needle, which as you can see is about 2 millimeters in diameter. This is passed after local anesthetic is injected, and we wait for that to work, which takes a minute or so, and then pass this catheter into the bone, inflate the balloon to elevate the fracture height and get back the alignment, straighten out the vertebra and get the height back of the spine. And then the balloon is taken out, cement is injected into that void, which also fills the remainder of the vertebra and stabilizes it, provides a nice rigid structure so that it's glued together, and when a person stands up there's no more collapse, and the bone feels pretty immediately painless. This has several major benefits. Person immediately notes that they're standing up straighter, they're not hunching over and falling over and feeling like they have to lean on a walker. Also, it now enables them to eat better because if they're hunching over all the time, their stomach's feeling full, they lose appetite, they have to take narcotics for pain relief and all the attendant problems with that. So with the goal of providing immediate relief and functional recovery in a faster pace such that they can get walking again, living independently, moving, driving, and caring for themselves, it provides a dramatic functional restoration on an almost immediate basis. And let me tell you about what's commonly not known of the major advantage of this procedure. Not only does it provide immediate pain relief, but one of the little appreciated benefits and most significant is the decreased mortality rate. A recent study in the past year in several centers published in Spine Journal reported there's approximately 43% higher mortality rate, that is to say death rate, in patients that have not undergone the procedure compared to those that did have the procedure in the 5-year period following the fracture. And that's a dramatic and incredible testimony to the success of this procedure. It's probably on the basis of holding the person upright, getting quicker recovery, maintenance of their alignment, balance, because they're standing up straighter than they would be otherwise if they start crunching over and leaning over forward and becoming more stooped and leaning on a walker more commonly than if they undergo the procedure. And that's compared to natural healing of the fracture, which can take up to several months or even longer.